Come on. It's going around. So there we go. That should be it. All right. Now we go over here. Should be coming up. There we go. Perfect. All right. There we are. All righty. Well, tonight we're going to be talking about your metabolic health and brain. We're going to talk a little about a couple of different things. And excited we've got the one, the only, the unique Cheryl. And Little Miss, right? Thriving at 80 with Cheryl, correct?
Right.
Perfect. So how'd your day go, young lady?
Busy.
Cool. All right. And Jennifer will probably be joining us later. And every week we get together. And as you can see, we're not sitting beside each other. First week where we've been not sitting beside each other on a Sunday night.
He left
me. Then about 100 miles away, right?
Right.
Oh my goodness gracious. And so we talk a lot about brain. We talk about Alzheimer's. We talk about brain fog. Jennifer will be joining us and we'll talk about caregiving. But this is a topic that is not only near and dear to our hearts, but is real. And we make some levity on it, but it's a serious issue. But people have got to understand, well, they don't have to do anything, do they? I mean, they believe what they want. But we talk and look at a lot of things from this perspective of the fact that my mom has Alzheimer's. She's 90. In fact, we just had we're celebrating her 97th birthday today. And look, there she is. She's got back from Target, right? There you go. And but today is our mom's 97th birthday. So was with her, and it was a great event, except for it had to change the venue because her home is in a small town in central Illinois, and there were 3 tornadoes around it yesterday, and there's no power. And so she was moved because of that from her own home to my sister's home, one of my sister's homes. And my sister is also the mother of our on the ground 24 hours caregiver. So the great thing about it is, we'll just talk about for half a second here, is the fact that we didn't have any sundowning. So if you know what sundowning is, go ahead and put that in the chat, guys. But if you don't know what sundowning is, it is a real issue for people that have a dementia level, and they get moved. If they get moved, or if the environment gets changed. So if they go to a hospital, my mom, several years ago, we had to take her in. I forget, it was gut something. I'm not sure exactly what it was, Jennifer. But Cheryl, she was just fine. She's a loving, nice lady. And, at that time, and still today, I mean, she's fine from that point, but, calm, never aggressive, never violent. She went absolutely berserk. She got in the hospital room, and she was trying to bite people. She was throwing things. They brought the the psych people down. They were going to remove her from the hospital because she was just that far out. And my brother, Tom, who's number 2, and I'm number 1. I've been around mom. She's been around me for 74 years, and I sing happy birthday to her. I say happy birthing day to her on my birthday. Happy birthing day to you. So that's a big deal. I mean, we've been together for 74 plus years, and but she was uncontrollable. That was scary. I'd never seen anything. I had no idea about it. And Cheryl, your sister, your identical twin sister, she experienced that same kind of thing, didn't she?
Yes, she did. She got very violent at one time, and they took her to Rush Hospital in Chicago, which was the most horrible thing I ever saw. How they put her on a mattress on the floor. It was very, very upsetting.
I'd be upset too. I'd throw a fit, but that changes the environment.
But I just thought it was very inhumane. I'm sorry, but that's the way I thought.
Sure. Now, Jennifer, your grandmother was, when you knew her, she was in some stages. Did you ever witness or hear that kind of thing?
I didn't witness it. There was a period of time when my 6-foot tall uncle was there, her son, and she thought he was a terrorist and became very upset, was trying to push this 6-foot man out a window. Mind you, the windows don't open. So a lot of the violent tendencies to her, I mean, she had no idea who he was. And, she didn't know who her husband was. So I don't know if that happened with my grandfather as well, because she had identified me as her daughter and my dad as her husband. So everybody else they weren't a part of her anymore.
Yeah. But that sundowning thing is a real thing. And I want to make sure we talk a little bit about that tonight, just now, because people, if they're not aware of it, that can really open up your eyes in a real heartbeat. And it's heartbreaking, isn't it, Cheryl?
Yeah, very.
Yeah, it's like
found out with my mom, especially. She didn't have Alzheimer's. She had dementia going on, but if they get a urinary tract infection, it can affect their mind.
Yeah.
But it's amazing how it whacks them out.
It is, and that's a really good thing to talk about, because a lot of times when there are complete changes or shifts in their attitude, in their mental composure, and you go, what in the world, what changed since yesterday?
Mm-hmm.
One of the first things we've learned to always look for is a UTI, a urinary tract infection. And they do become more common the more people aren't, bedridden and that type of thing too. But not just that. But a UTI can say, hey, let's get that fixed. And it's an easy, quote, easy fix, isn't it? I mean, to be able to do that and move through it with medication, that's one thing that medication can actually do, and you could get, a lot of times people will be on cranberry pills, right? That's one of the things that helps keep that to bay. But urinary tract infections and mental mental attitude clarity is a big thing. But those two things. So now look at the two topics we've already covered. We've talked about urinary tract infections and how that affects one's moods. We also talked about the whole thing of moving and sundowners, that sundown syndrome. And have you seen that? That's not any issue with your parents that you're watching now, is it? Caregiving for, is it right now?
I haven't seen the sundowning in either one of them. I would like to talk on the UTI though.
Okay.
At times it's not, because I think of their generation, it is not a openly discussed situation. We are dealing with some incontinence with my mom, and um, she at times will tell you 4 or 5 days into a UTI that she has one,
Hmm.
rather than I have the onset. And she does do a cranberry vitamin every day, which seems to keep it at bay. But I will say that she'll get very, very confused. So trying to discern, have we moved forward in the progression, or is there something else going on?
Sure.
And doesn't always want to have the open conversation. Well, yes, I frequented the bathroom 15 times last night.
Right.
It's not. I think it's when it gets so bad that she's like, I can't stop going to the bathroom.
Mm-hmm.
And it's trying to figure out the right combination. Yes, the medication 1,000% in this case
Right.
does wonders. Now I didn't have the sundowning experience as of yet. I did have a situation where my mother woke up from a dream. She was in the bathroom getting herself freshened for the
Okay.
morning and was convinced that we were moving. Absolutely convinced. Told me to stop physical therapy, call her, tell her not to come. The movers were coming, and I was going to an event that day. And I said, no, I haven't had any time to plan. Don't have anything packed. Let's hold off, because I did not know in that exact moment what exactly was happening. I
Right.
didn't cross the threshold, so, and thankfully the physical therapist still came, and I messaged her and I said this happened, and apparently my mom was still stuck in sleep. She was
Oh.
stuck in her dream. She thought it was her reality.
Oh. Yeah.
Wow.
So it's as shocking as seeing someone that is sundowning, because
Right.
you don't know what the mood's going to be. You don't know what's going to come out of their mouth. You don't know what version you're going to get in that moment.
Right.
It is. It really is something. I mean, if you've ever had a UTI, and ladies, I'm sure you've had at least one, because I don't know anybody that's ever been totally immune personally. I don't like them either, but quick as I've ever had one, I like, this is not good. I want fixed now. Um,
Mhm.
and sought that out. But is it something that you see that makes sense at all? That how that stuff all works together with the mental attitude and things?
I really do, and I say that because I actually have I have an aunt who does not have Alzheimer's or dementia, but did have a UTI so badly that she was completely confused as if she had Alzheimer's or dementia.
Wow.
Didn't remember to take her medications. I mean, this was like a very serious case.
I
And
guess.
so it absolutely, even if you don't have Alzheimer's and dementia, UTIs are just wicked little things
I think.
that can turn into something so serious that you have to be hospitalized. And when you have somebody with cognitive decline, especially, and they don't drink enough water, I'm looking into things like jelly drops. They're a little bit on the higher expensive side, but they look like little candies that
Okay.
are 99% water,
So
Oh.
to
because
hydrate them.
dehydration is such a big thing,
Sure.
especially in my mother.
Yeah.
I could always tell when one was coming on with my mother
Mm.
by the way she would talk and what she would say
Mm-hmm.
and how she would act. And she lived in assisted living at the time, and she and my stepdad's daughter was the administrator over there. So, we would always agree to, yeah, that's what's happening.
Mm-hmm.
And, take her to the doctor and get it taken care of. But yeah, I could always tell when one was starting, the way she was talking, the way she was acting.
It's almost as if they're more confused than they normally are. Like
Right.
saying random things is what comes out.
Right.
And I'm like, do you know who I am? And I start with, do you know who I am? And then I always say, do you know how old I am?
Oh,
Because those are two things that on a regular basis, she will know the answer to.
sure.
And when she starts making me younger, I know something's wrong.
Yeah.
Well, I'm sad that your brother and you and your family had to go through that, George. That is it
Well,
is
I was
definitely a
sad
traumatic
that
situation.
mom had to go through it. That was the whole insanity of it. Yeah, Benita. Yeah, UTIs are absolutely the pits, and cognitive decline is apparent when they're present. Yep, all the sugar deposits and kinks in the urethra. Good play, Benita. Benita is one of our expert nurses in the world. She is also a card and a half, so we love having her chime in on some things. So, but yeah,
Absolutely.
so we've talked about sundowning tonight, and we've talked about the UTI. We got into that whole thing. I want to talk about something that have you either one of you heard of this? You might want to write it down or just remember the letters POLST. Do you know what, if you know what POLST stands for, put that in the chat too. I'll give you half a second so you can quick Google it if you need to. Who uses Google anymore? Everybody uses AI of some kind, chat, I guess. But POLST, have you heard of it before, Cheryl?
No.
I have
Jennifer?
not. No.
Okay. What it is something that everybody needs to become aware of. And I mean everybody in a broadest sense, because it stands for provider order for life-sustaining treatment. Okay. Some places known as physicians, but it is the providers, the professional, communicating the orders to keep you alive, or what to do to keep you alive.
So where did you hear this?
My brother Fred and I just talked about it. And it's like you've heard of advanced patient directive. Some the order for healthcare. There's all different types of words on it, but in the general sense, the general term is, and I'm not an attorney. I don't even play one on TV, or I didn't sleep in a Holiday Inn Select last night. But what it is that if someone goes into emergency care, a lot of times there's no documentation that comes with them, right?
Right.
Or necessarily on record. And so you get there and you may not have that document with you. And we got all kinds of chaos going on at the time, don't we? Emotional chaos, all of the things going on. And you get what comes in front of you. All of a sudden there's here, sign here, sign here, sign here, sign here, sign. How many of you read any of that? No, because you're constantly, we're looking over here. What's going on? Who's, what have you, right? Just in the normal emotional state. Would that be correct? I mean, that's, So
Yes.
now it goes, you think you got to sign all these things, but you have no idea what you're signing.
Right.
Right.
And now those orders can supersede anything else anywhere else.
I mean, if they have you sign that at the hospital.
Now they have control. Whatever their standard, and you know how fast they want to get you out of the hospital anyway, right? And how fast they want to turn things over, seemingly, But that now that whole thing, DNR, no DNR, this, that, and the other, is now signed on the document that you just put your name to.
Mhm. So if I'm understanding correctly, you're saying that the document, the POLTS, if that's
POLS, yeah.
okay, I got it screwed back. I got it screwed up. That
PO
document, no
physicians,
matter what, is
yeah,
kind of like
prescriber,
the
yeah,
document.
unless you got something over, and I don't know that it went when and or if it gets overridden while the patient's there. Now, part of the conversation, guys, on this is because, and then following up with more, is that mom, who is now under hospice, won't ever go to an emergency room.
Right.
Yep.
No, she'll go, if she goes to a hospital, it will be to the hospital, not
Yep.
by way of the emergency room. She's under hospice care. She's not going to go anyway. But that's those orders. So I just encourage you both of you to look into these, and people that are watching this, be aware and get some understanding of POLST in terms of a planning tool that you may sign if you're with the parent or child or whoever, and we don't have any organized plans in place. It's something I think I certainly wasn't aware of it, and that's not like I'm supposed to know everything, but having been in the financial services industry and planning for as long as I was, it's not something I'm aware of, and something I didn't know, and something that I just think needs to be brought to light. And so I wanted to bring that up because that applies to, again, we live in the real world, don't we? I mean, Jennifer lives with her parents that are kind of my age, in their 70s, 80s, right? So, right?
Yeah. Yes. One is 83 and one is 80.
Okay, so they're Cheryl's age.
They are Cheryl's age, but I will say with the utmost certainty that Cheryl's ability to navigate at the age of 80 is 1,000 times. It's like night and day.
Sure.
To what I'm dealing with.
Right.
Cheryl is a mover, a goer. Exercising, doing things, staying positive, not in a depressed state. I have that around me all of the time. It is. I am the nursing home.
You're right. So let's go
on that thought, George.
Yeah.
So when my husband was dying, if that paper would have been signed, I couldn't have said what I said as all the machines off him.
If you have, so you had the advanced patient directive. So you're, but when he went into the emergency room, if you signed that PO, then it would have stayed into that. But now he's in the hospital, then you should have, that should supersede the document. Now you give it to the hospital, right? When you get there, and do you have a living will? That's another word for it.
Remember, it happened so fast. I really don't.
Exactly.
But
that's the point. Yeah. So yet, if there wasn't any other document available, then they're going to follow that whatever that is that's in there.
Yeah.
But I haven't seen one to read it, so I don't know. And I
Sure.
don't know if they're standard or not. But I just bring that up as, hey, listen, I don't know anything about it. I think I'm going to research it
Mm-hmm.
because
Well,
I need to update my document. I
when
have one actually.
so fast, you don't think about that stuff. And it's probably
Right.
something you have in your car or,
Yeah. One thing that I always would advise my clients to do back in the day is I would tell them to, when they have that advanced patient directed living will, various parts of the country call it different things. So there's not a standard name. And there are some states that have a statutory one. You can just print it off and fill it out and go with it. So that has it. But I would tell clients to take a copy and put it in the suitcase that you travel with. I'm sure, Cheryl, you travel with about the same suitcase every time.
but there'd be no room for that. I had to interject that one.
Yeah, that's probably would add the weight that would cause you to have to pay extra.
It would.
But it's a 3, 4, 5 page document, okay,
Oh,
and have that in there. Have that in your travel suitcase, so it's present if you're traveling, and have others know where it's at as well. And those are good things to have. Hey, there's Sonia Martinez who said hi. Okay, good seeing you, dear. So one thing I wanted to know is that when you start looking at that, are you the power of attorney for healthcare then, Jennifer, in your situation? And Cheryl, do you have a son or a daughter in charge of yours? Who's your healthcare POA?
oh, one of my kids. I don't remember.
Okay.
I might put say no.
my daughter is for me.
Okay. Okay. And they have a copy of the document that you want and stuff. One of the things to be careful of, I'll just say this, is that in those documents, a lot of times if they're just the rubber stamp state statutory document, which has the minimal thing is make sure that you notice that you have notes that whether, for example, if you're choking, do you want them to stop your choking? I mean, in a true DNR, our buddy John wouldn't be alive today
Mm-hmm.
because he was literally choking on a piece of steak with our buddy Doc with DK at a restaurant in Texas, and DK performed the Heimlich on him and saved his life. But if there was a thing where if something happens, like that, there could be such that you wouldn't. Oh, he's choking. Do not resuscitate. Don't do anything to help bring him back. That's how documents can actually be. So you want to kind of polish that up a little bit so that you understand. You can't have a broad brush, but there are things that we want to, come on, be practical. Just let me just go out on the floor at no, and our buddy John's around because of that acting. So that's one thing that, again, these are just we're kind of doing housekeeping talk tonight. It's kind of a little bit different in that. And so in housekeeping talk, we'll take this brief moment to have from our sponsor and talk about two things like these two ladies. And I'll let you go first. What do you want to talk about that's making a difference in your life with the feel great?
Well, the protocol: take 2 teas a day in a balance before your biggest meal. I've been fighting my doctor for what, 4 years now? 3 years?
Yeah, at least 4.
Because my parathyroid has been high. The first doctor I went to sent me to a specialist, and I got to the clinic that day, and they said, "Oh, by the way, she's on a television screen. She's in Texas." So she asked me, she says, "Well, what are you here for?" And my first thing was, okay, you don't read notes before you just see the patient, because they had notes. And I said, for my parathyroid's been high. And the first thing out of her mouth, "Do you want it out?" I said, "No, I don't want it out if I don't have to have it out." And so I saw her twice and got rid of her. So I didn't really like her bedside manner, so to say. And then I went to another one in Peoria, found another one in Peoria down where George lived. And because I thought if I had to have a surgery, then he'd be right there too. But the first thing out of her mouth was the same thing. And I said, "Well, aren't you going to run tests?" So she ran some tests. It was still high. I went to her a year apart, or 6 months first time. 6 months, I think. The first time it was still high. Second time it wasn't quite as high. Anyway, by the, I don't know, fourth or fifth time I went to her, it was down normal. And we've been keeping an eye on it. She released me. And was I on the protocol at that point? I don't remember.
Yeah.
But it's been, yeah, I guess I was, but it has been normal since.
Yeah.
They're really keeping an eye on it.
It's pretty incredible. The first thing the doctor that walked in the one clinic that I was with, she walks in the door, and Jennifer, she looks at Cheryl, goes, "Hi, when do you want it out?" Like, what the flying horse feathers are you talking? What out? Like, what? It really was. It was literally the first things after hello. When do you want to schedule this out? When do you want to schedule your operation?
What?
And I'm sitting there looking at her, and I'm looking at, I'm like, what operation? What are we, And so, yeah, so that's the protocol has take care of that for you, hasn't it?
Yeah, it has, but we're watching it. I have to go back in 6 months, have another test, which I'm fine with. I want to keep an eye on it too. But, it was pretty high at one point when I first went to see her. But
now you just had your blood work done.
Oh yeah, it was great.
And what was your blood sugar was like what, 75?
Yeah, something like that.
And your your blood pressure was what? Like
120 over 60.
Yeah. Yeah, you were like there. And that was a little bit high for you. So, but yeah, all of our markers are just like, why do we bother? It's like crystal glass, that kind of thing.
Well, I'm fortunate.
Very. You are. So Jennifer, what's the biggest benefit for you with their system?
Well,
what is it you're seeing?
Is there one thing? No. I will say though, I also had my blood work done.
Oh, and do tell.
I educate people on figuring out if they have insulin resistance.
Yep.
Okay.
How do you do that?
Triglycerides.
What do they do if they want to know if they have insulin resistance? What should they do, Jennifer?
This blew my mind when I first learned about this a year ago. You take your triglyceride number and divide it by your HDL.
So take the triglyceride.
Yes.
triglycerides,
And
and divide it
yep, and divide it by HDL.
by the HDL. Okay, so math
Yes.
is involved.
A little bit, yes. The wonderful
Okay,
thing is I love calculators. I did come from the generation where we did know how to count money.
okay,
But once the calculator came, I was very excited.
Right.
Takes all the extra thinking out of things.
All right.
You know, I was one of those. And sometimes I catch myself and I'm thinking out loud and I'm counting on my fingers and I'm like, really? I'm 51.
yeah,
But it's so ingrained in my head.
right.
Anyways, I digress. So when I started the protocol, I divided those numbers and I was at a 1.75. Now, realistically, the best gauge that you want to be on is 1 or less. When you hit 2 and you hit 3, we're talking the insulin resistance is more prevalent. Okay, so when I went, I'm 1.7. Well, that's good. But I was on anxiety meds, cholesterol meds, insomnia meds, had hot flashes, had menopausal weight, had inflammation. And I was like, okay, I'm not too bad. Well, I am proud to say that coming up on a year of being on this simple little shakeable tea, and my results are 0.66.
Oh, get out.
I
Right.
have graduated to insulin sensitivity. Thank you.
Oh, phenomenal. Phenomenal. I love it. I love it.
Now, when we talk about medical professionals, my doctor she is definitely overweight. There's no denying this. She's riddled with eczema. She started using a cane. She knows exactly what I'm doing. She knows it's in the physician's desk reference.
Okay.
And it breaks my heart,
Sure.
but I also know for myself, it took me 6 months to start
Mm.
because I have been so programmed that meds are okay for me. And I was not an advocate for myself. I did not do the research for myself. I just said, okay. And now the TV's telling me all the time, okay, I must be doing the right thing. Well, I didn't want to be on meds anymore. I didn't want to be miserable anymore. And when your mom tells you you're happier now than you were on those meds for 16 years, I mean, that's a win-win.
Absolutely. Gotta love it. Well, congratulations. I'm glad that those things are all working great for you. It's wonderful to know that. So if we go back and Cheryl, tell us a little bit about let's have a little conversation about your sister. Now, you had a twin sister.
Identical twin.
Identical twin sister. Okay.
She was
And by identical, that you're what's that called? Mirror twins or
no, identical means you were in the same placenta. If you're not identical, you're separate placenta.
okay.
So we were the same. We were called mirror twins, basically, meaning sometimes organs would be on different sides of the body, which I don't know about that, but Sharon was left-handed. I was right. Well, in those days, the teachers didn't want left-handed kids. So they switched, made sure you did not use your left, you used your right. And she did. I mean, she had beautiful handwriting. But that's kind of what they call mirror twins. Sometimes the world
Okay.
will be good,
Okay.
things about that, but we were identical in looks. It was funny though, when I look back on pictures that we had taken, we would always stand on the same side that we were used to standing.
Okay.
And I would usually be on the right, Sharon be on the left. But it's just because something that I don't know. It's just something automatic that we did. So, and pictures, we would always be, usually, you know, somebody say, let's take a picture. So we've moved our spot, which we were comfortable with. But
Yep. There we are. There we identical. Look at those two. They're cute. Golly bugger.
about 5 years old.
Oh, cute, cute, cute.
I love that picture of you too.
I do too. Have another picture too that I really like. I don't like
this
that.
one you don't like.
She doesn't like that one.
So I keep it in the mix.
Oh, thanks. I like this picture. You can see it. I love that picture of us.
Yeah.
I think it was her son's wedding. And I like this picture too. I forget what I was going to say now. Anyway.
Well, the story about the outfits, right?
Yeah, well, the sweaters we have on these, her kids had bought that one for her, and the same colors, everything. And my kids had bought mine, not knowing. Neither family knew that, you know. But so, yeah, we would send each other our mother, the same Mother's Day card. We thought alike, we looked alike. My dad could not tell us apart unless we had our kids or our husbands with us. When we were new babies, Mom had us in bassinets, and my uncle and my dad snuck in there, switched us. My mother knew right away which one was they weren't the same right ones. She knew right away. She could always tell us apart. Our kids could always tell us apart. It was funny when she had her daughter. I went out there the night she got home from the hospital, and her little girl was fussy. I picked her up, and she knew right away that I was not her mom. She knew right away. When I gave her back to her mom, she settled right down. So the kids had a way of knowing. My kids always knew from the time they were little, you know, which one we were.
Sure.
But she was diagnosed with early onset Alzheimer's when she was 54, and she died when she was 61.
54 to 61.
But we think she had it before. We know she had it before that, before she was diagnosed.
Sure.
But I lost half of my whole
Yeah.
Lost half of my whole. So. And it's funny, I love watching twins. There's just something, even if they're little or if they're grown up, I just love watching them. So
When your sister, your identical twin sister, was going through this, was she aware? Was she cognitive that this was the situation for her? Do you think did she ever think that she was forgetting that did it ever seem like she acknowledged that she had an issue like that or not? Do you recall?
no, not really. The principal she worked in the guidance office at the high school or junior high, and the principal called her husband one day, and he said, I think there's something wrong with Sharon. He said she used to love the kids. She doesn't have the patience for them anymore. She would call me almost every night during that period. Of course, I didn't know what was going on either. And she would just be so upset. These kids are driving me nuts. And some lady was just really bugging her, and that wasn't her. And so when I look back, yes, that was the beginning.
Sure.
But after she was diagnosed at Mayo Clinic, we were on the way home in the car, and we were sitting in the back seat, and I'm looking out the window, trying not to let her see me cry. And she grabbed my hand because she knew I was crying. She grabbed my hand. She said, well, at least I'm not dying. And it just broke my heart. She didn't know. She did not know. And then another time she said, well, I guess she had talked to the minister, and she said, I'm not afraid to die. So, but then they reach a point where they don't even know what is going on at all.
Sure. I wondered, a question I had when prior to the diagnosis and the trip to Rochester to Mayo, had you guys had any family experience with dementia or anything like that at all?
No.
So there wasn't any.
My great grandmother, but she was in her late 90s by this time, or mid 90s by this time. She would talk about things that happened really, really far ago, you know. But I mean, that was her age too, you know. But she might have had something, but never ever. I mean, that was the biggest shock of my life when I heard those words.
Yeah, because the point on part of helping to share the story is that exactly that. I mean, it used to be dementia, Alzheimer's, 80, 90, older
Right.
people, right? It used to be older people. And I have to say older people because we're that age,
Right.
being 74 and 80. And, it was an older thing. But your sister, was struck, developed at 54.
She's the age of my daughter. And when I looked that way, it was just like, oh my God.
Right. And that's where we start talking about now more and more that the age of that's coming down.
Yes.
And it's when we cross the crossroads of the changes of our metabolic health in the modern day food environment, when we start layering those on, that's why we do this. That's why we're talking about this, because it's a real thing. It used to be, but it's not.
Right. I mean, look at all the little kids that are starting to get diabetes.
Yeah. All the different kinds of metabolic health conditions.
Right.
And we got our friend David's on here. And hey, Mary, nice seeing you down there. Thanks for coming on. And the transformations that people have when they realize this. And Benita, who was on earlier, is exactly, we are able to make those modifications. But brain fog is a real thing. And Jennifer, I don't know about you, but was brain fog something that you ever dealt with?
Oh my gosh, yes. And
how young were you? How old younger were you when you started doing that?
Well, if we start with where are my keys, where are my phone? That probably started in, I don't know, probably in my 30s, my 40s. When it really became apparent to me, I was in the severe stage of brain fog where I was putting my parents' medical appointments on the wrong weeks and on the wrong days. And having your parents drive 45 minutes both directions for an appointment that didn't exist was terrifying.
Sure.
And did you, because of knowing Grandma Mabel and that, did you have any internal inkling that something like that, you might be on that same path?
George, since I was adopted, I really didn't know.
Okay.
I did find my birth family in 2020 during COVID, and I asked all
Right.
kinds of questions. Who gave me this? Who gave me that?
Okay. Great.
But Alzheimer's was not one that had come up in discussion. But I also have learned that a lot of the high cholesterol, the brain fog, the joint pain, all the things I was dealing with, I didn't know they were rooted in metabolic health. I didn't know it was driven by insulin resistance. And I was always told it was genetic.
Yeah. And Cheryl, going on genetic to you, that's why I asked the question. You're identical twins, but there's
Right.
no familial history of it at all.
No.
Yeah. And in my case, when I had my ultra extreme blood sugar, and for just quick note, everybody, that my in October of 2024, when I was 72, I had on a 20-hour fast, which still boggles my mind. A 20-hour fast, my fasting blood glucose was 834 with an A1C of 18.1. I should have been in a coma. I shouldn't be here.
No,
We
you
should
should.
not be having this kind of thing. And thanks to Cheryl's insistence, I went. And then when I got the results,
No, I think he got scared. That's why.
yeah, I kind of got scared. I got scared because my brain fog. So I was here in this house one day, Jennifer, and I was going on an audit, working in stores, and on assignment, and I went out the door, took out the driveway, like all of 10 feet, whatever, took a right. I went, that's 100 yards maybe to the stop sign. Shit, I forgot my phone. Not that no one else has ever done that, but no one turned around. I had to manipulate because it's a T intersection. It's not like that. So I had to manipulate around a closed block, came in, and was right on the butcher block, right there, where I left, right there. Got in, relocked the doors, got in the car, drove. Where's my drink? Turned around, left. Oh, I forgot my lunch. Came back around. Oh, I forgot my briefcase. Came back around. And I don't know. I have 5 times. 5 brain farts. Wasn't even fog. I mean, it was just like, and I told Cheryl, I had told her that I was really I was concerned.
He was concerned, but he didn't tell me that all this was happening.
I just told her I was concerned because I was, cause my mom and her dad, her dad, our grandpa, got dementia, so he had to be in the enclosed container rooms,
Yeah.
And I didn't, and all of all my uncles had organic goofy things. I weren't really necessarily dementia, but they had all kinds of organic issues, and so like I'm going like, what the flying hang? And I don't want to go down that path at all. And so we didn't go down that path because when I found out what my numbers were, I told the doctors, and I was with 4 attendees and a bunch of other people in the room when they gave me my results. That's a whole nother story. And I said, thank you. I said, thanks a lot. Now I know my numbers. And I walked out. I walked out of that, much to the chagrin of everybody in the world, I think. But I walked out with no meds, with really no plan, other I was going to find something, because food got me into this mess. I knew food would get me out. And it was really sad because for the brain fog part for me is I love to sing, and I love choral singing, and I love Latin. I love old Gothic type music, that type of thing. And so, especially if you're singing the chants of things, it's a whole different uh, notation system. It's only four instead of five. There's different names for notes, and it's a whole nother deal. So it's not the simplest thing in the world.
Mhm.
And I love it, and I'm passionate about it, but I couldn't really read it so well. And that was really, I didn't want to give that up. I didn't want to lose that. So yeah, so now it's, that's not the issue anymore. And I've been able to, in 107 days, I went from 834 to 90. So it's doable. I'm living proof of it. But the whole idea is that when we start talking about brain fog, it is a symptom, but not of old age.
Mhm. Yep.
And my vision was wonkier than yesterday and tomorrow. My and Cheryl's seen it. It looked like it. It looked like when you look at my eyeballs, it looked like oranges. The cornea, it looked like oranges.
Mhm.
I couldn't see. I had when I pull up to my proverbial stop sign just right up here. I ended up having to roll the window down to hear if I could hear trucks or cars coming.
Wow.
Now these are all things Cheryl didn't know
Of course not.
after the fact, But that's
But when he finally took himself off the road
yeah.
to stay with me.
Mhm.
By the way, I don't know if you've noticed we're not in the same house tonight.
I did notice this.
Well, he had to go to his mom's birthday today, and then he's got some projects he's got to do down there. So he's going to be gone a whole week. But I said,
What?
we go a whole week without seeing each other, except on the weekend. And there's times we go 2 weeks without seeing each other.
Yeah.
So,
But I have my protocol. I've got my little satchels to keep me happy. So, on the close of today's show, I'm happy you guys. It's so great to have you together. Cheryl, I congratulate you on your solo flight on a live.
you see, I keep moving my phone though.
That's okay.
I'm holding my phone.
Totally fine.
Totally fine. I'll get you a gimbal. You'll be fine on a little stand, but you're doing great.
Thank you.
So I applaud that. Jennifer, I applaud you again. You're doing great. And you're doing super. You're doing fantastic. I know we've got this challenge coming up. And that should be fun. So, and then guys, with one of the things that's happened again, I just want to do another thing just about able to get more information to people, is our company is phenomenal in that we have an app. If someone comes onto the protocol, they not only have an app to track their fasting, but it'll also track their food and even track people's, especially ladies, your cycles along with how to fast.
There is also a new feature.
And that is
a full body scan.
A full body scan.
Yes. You can see my excitement. Yes. Yes.
I don't get it right now because I'm on an Android. I have to wait yet.
And what does that tell you?
Everything.
It's going to tell you things like your fat to lean muscle ratio. And that is like so intriguing to me because, at this point I have lost 40 pounds.
Right.
And I have the body I had in high school. And I'm 51. And part of the challenges that George was talking about, one is One, we're actually competing against each other, yet with each other. But the other one has to do with developing one's body. And for me, I'm looking at putting on lean muscle.
Right.
So to know where I'm starting, because I do have a potato and it is defined, which is nice.
Right.
But I'd like to fill myself out a little bit, not like I'm going on stage in a thong or anything, but I want to have some definition.
Really?
And I've
Stage.
never had a six pack, and I think I kind of want one.
Oh, awesome. Debbie,
I
congratulations.
did at one time, but not anymore.
It's exciting.
Well, I got to show you guys as we close out. I want to share this picture.
Oh,
Hang on here. I got to turn this off. There we go. So there's, that's today. That's Mom and Deshante, who is a niece and caregiver, and Maddie. And they're reading, Mom's reading the letter from one of the grandsons. And then this picture I'll share. This is Mom now. Mom looks like she's mad, but she just put a circus peanut in her mouth. You know those orange circus peanuts? You can kind of see all there in her front of her gums, you know.
You don't find her smiling very much in pictures.
Sometimes, yeah, but there she got a orange peanut.
She loves those
Yeah, she does.
things.
Yeah, she does. So that's yeah. So to prove that that's what they are is there. See, that's there. See, it's circus peanuts. But anyway, that's her 97th birthday, and you know, it's all great, a lot of fun, and so I love you two girls, and thanks for coming and sharing again. We'll see you next week as well. We should have some kind of fun discussion about a couple things and some of the new science and some of the new ideas behind the ability with lifestyle intervention to do so many possibilities, including, we talked a little bit last week about the twin studies up at King's College in London, I believe. So we're going to keep going on deep diver into some of those things, but wonderful to see you both. And I miss you both. I can say that publicly. And I love you both. I can say that publicly too. So you guys have a great night. Thanks for coming on. Anything else you want to say before you sign off today?
Call me.
All right. I'll call.
It was great to see you both.
Same here,
Keep it
Jen.
going.
Thanks, guys.
All
Love
right.
you. Bye.
See ya.